Hello and welcome to the Anaheim Convention Center. I'm Ron Roberson. Today marks the 10th annual Anaheim Free Health Fair, where more than 150 doctors, healthcare professionals, and community members volunteer their time to provide vital health screenings and services. We're with Dr. Choe, one of the few people that helped makes this all happen. And sir, tell us about today's event.
So far, so good. We've got 200 plus people waiting before 8 o'clock. And I've heard that people have been here since 10 p.m. and midnight, etc. We open the doors at 3 a.m. and we've got lots of services here and it's going great. Yeah. We're just trying to speed up the process to help people faster, but otherwise it's amazing. This is unbelievable.
What kind of services are you offering this year?
We register people, then they get their vital signs, which is blood pressure, heart rate. Then they get their questions answered about their health and measure their hemoglobin non-invasively. That's Massimo Company's devices, which is based right in Irvine. From there, they are asked about fasting or not, and then based on that, they go to blood work, where they are going to have their lipid profile done if they are fasting, otherwise total cholesterol, and sugar for everybody. And if they need hemoglobin A1C for diabetic people, that gets done. And we do have provision to do a few other tests, which is only if a doctor recommends.
And no event is complete without organizers, and some of the people that work behind the scenes really make this happen. I'm with Ed Gerber, and tell us about your organization and some of the things you're involved in.
Sure. My name's Ed Gerber. I'm the executive director of Lestonnac Free Clinic. Lestonnac Free Clinic has been providing free medical and dental care to the uninsured for 37 years. So partnering in this event was a no-brainer for us because we want to help the safety net to really protect those that are left without insurance and nowhere to go. So for us, we're happy to be here today. Today, we are actually the licensure facility for the event. So all the medical and dental things that are going on at the event today actually work under Lestonnac Free Clinic's license, under our malpractice insurance, and all of that goes along with it. We're doing our best to provide not only a one-day fix, but in medical especially, we're giving them a long-term fix. So we can tell them, you can come here, it's free. You don't have to just come to this event once a year.
Well, Mr. Gerber, thank you guys so much for what you do. And again, it's top quality service. We're not just bringing anybody here to make it happen. You guys do a fantastic job.
Well, thank you. My pleasure to be here. I'm excited every year when I hear of this event. So great time.
And we're excited as well as we continue to go around and look at some of the other people that are making this all happen. Be right back. Okay, I'm with Deepak Patel, and you're in charge of all the volunteers here, and you see them running around, and these people are giving of their time, their efforts, their services, and it's got to make you feel good. What goes into getting the volunteers all together?
It's basically asking out for volunteers who want to help out all at least help out the patients who need help and all that stuff. We generally go to the schools, the colleges that have medical, I guess in terms of classes and trainings and things like that, and we reach out to them. And a lot of students want to help. Two reasons. One, so that they can learn practical stuff, and secondly, just to help out and make sure that they're given the right services.
Yeah.
So we do get that. We also get a lot of the community that help us out, who are here just to help people. And I think at the end of the day, the goal really is to talk about making sure our community is healthy. Because if the community is healthy, society becomes healthier. So that's our goal. And for the volunteers, it's an awesome thing because you ask them to, and they're just willing and ready to do anything and everything for us.
One of the stations you might want to stop by when you're getting your free health check is having your blood pressure checked. And I have this lovely young lady here helping me out. And also I have Martin with me. And Martin, how important is this station?
It is very important. It's actually where we take vitals. It's where we start you off. We'll take your blood pressure here, your pulse, and your temperature, which is vital to the information that they require at the other stations, like dental, mammograms, which is all provided here at the fair, at the health fair.
And again, a lot of people have high blood pressure and those type of things, and I believe they call it the silent killer.
It is, absolutely. That's why it's very, very important to take your blood pressure, and if you do need medication, to take that medication. Your doctor is the primary source of your health.
Yeah.
And always listen to them and do what they tell you. Diet, exercise is very important for everybody.
Yes, indeed. And what happens if you run across somebody that might be in a little trouble?
This is the first step. This is the first step. It's where we measure your vitals. If your blood pressure is a little high, we do have medical doctors here that will help you. They will lead you to the first place, the place that you need to go so you can get your help, medical help.
Martin, you could be at the beach today, kicking back, maybe in a hammock somewhere, watching TV. Why volunteer your services?
Because I feel that this is important for the community, and that's what we're here for. We are in the health industry to help people, and I honestly believe that that's what they need. And people are here. They've been here for a lot of hours, some of them, and we're more than willing to help them.
Thank you so much, sir. Appreciate it.
Yeah, you're welcome. Thank you.
And of course, we have the Lions here, and the Lions are known for eyewear and making sure that kids can see clearly. And people of all nationalities, I tell you what, they do a fantastic job. And with me is Kenneth Myers. And sir, tell us about your purpose here today.
All right, our purpose today is to do some eye screening for the people in the community around here. Our main goal is for sight and vision, of course. We do have other charities that we do, but mostly sight and vision.
Right. And we noticed that you have some things going on. I know you're doing actual screenings. Will people actually be able to receive any kind of eyewear or anything here today?
Okay, today we do not have that component with us, but what we do have are computers in the back that once they come in, they get a complete eye screening. We take them over to where the computer is, we sign them up for glasses, and they'll be mailed to them within 2 to 3 weeks.
That is awesome. And again, all the services are free, and you all are coming down and volunteering. It's got to make you feel pretty good.
It does. The reward is when you see someone walk out with a smile on their face and they grab you, shake your hands, and say thank you. There's your reward.
All right, and there you have it, folks. The Lions are in the house and doing a fantastic job. We're going to go around and look at some of the other booths and see some of the other folks that are here. Okay, we're in the dental area. This is an area I kind of wanted to avoid, but I had to come here anyway, and a lot of people don't get the kind of services that you all are offering. Tell us what's going on behind you and how important is it?
Yeah, we're offering free dental services, limited to cleanings, fillings, and extractions today for the health fair. And normally we serve the uninsured poor in our community.
And what exactly goes on in your area?
What I do is I oversee the providers, making sure all the patients are kept happy, answer any questions they have. We really want to make this a positive experience for anyone that comes and visits the clinic. We want to make sure that they matter to someone and that we're really focused on making sure that we hear their stories and that we care about them. All our providers are here only because they want to serve. They're not forced to be here, and that just gives us such a higher quality of care for the patients.
Higher quality of care, that's kind of the operative word here. We're not talking about a pair of pliers and whatever, but you guys have laser. I see everything going on behind us.
Yes, we've brought all the equipment that we use at the clinic. Yeah.
And how are you able to offer these services for free?
Everybody here is a volunteer. Yeah.
And then we get donations and sponsors to help provide all of the supplies that we have. We do get a lot of donations of the higher quality materials, which keeps our dentists happy, and it's a longer lasting restoration for the patients as well.
No need to be shy. Come on down if you need the work, you need the help. Come on down. They're here to support you and to get you the services you need. And I'm with Sandra, and she's one of the happy people that have come through the health fair. And Sandra, how's your experience been? Walk us through what you've been through today.
Wow, it's been amazing. I'm very happy that you guys offer all these things to us, and especially with everybody volunteering and giving us all these things. It's a blessing for me.
Now, if I'm not being too personal, what are some of the things you're going to have? You've already been through a little bit, and what are you going to have done next?
I'm looking forward for the dentist and dental work and for the eyes.
And what have you had done so far?
Well, I'm still waiting for the dentist, and after I'm going to go to see the eye doctor.
Yes, indeed. And what would you say to some people that may be a little embarrassed to come down or what have you, or maybe scared to come down? Tell us about your experience.
Don't be scared. They have all these things that they're offering to us for free.
Yeah.
Oh my God, you need to come down and enjoy what they offer because it's a blessing. And not only that, I was here since early in the morning, and you know what? They even have food for us. So, wow, I'm happy. God bless you guys.
All right. And thank you so much, Sandra. And once again, no need to worry. Even if you don't have transportation, I understand that Yellow Cab is providing free rides all the way down here to the Anaheim Free Health Fair. Isn't that right? All right. We're going to go around and talk to some more people. And we're with our Mayor Pro Tem, and she's also the co-chair of this great event. And you got to be feeling pretty good about the turnout and the joy on the people's faces that are enjoying the services.
I really am. We're going to have a couple of thousand people coming to the health fair between today and tomorrow. And healthcare has gotten so expensive, and there are so many people who don't have access to healthcare. So this is wonderful. We've got 20 chairs for dentistry, and that is the most popular one. That and vision. So there's a need in the community, and Anaheim hopefully is helping to supply a little bit of that need.
Yeah.
This is the Anaheim way. We all come together to provide critical services to the entire Anaheim and the greater Orange County community. What could be more important than providing free healthcare services to all of our residents? And wonderful community leaders, the city, we all join together to make it happen. That is the great tradition we have in Anaheim, and it has grown every single year. It's growing so much that we are going to have a second health fair in December. And to think that it started 10 years ago at the Brookhurst Community Center with just 200 participants. With the December opening right before the holidays, we could have upwards of 4,000 participants. And to make sure that every single child in Anaheim has the opportunity to be fully screened and healthy going into the new year, just fills my heart with joy.
I understand that there's a very special tribute to one of the co-founders.
That is correct. 3 people started this, and it just so happens that I'm the lone warrior standing here from the 3 people. One is Honorable Harry Sidhu, who was a council member of Anaheim City for many years, and late Mr. Pravin Mody, who is the owner of GBS Linen.
GBS Linens wanted this health fair to occur for many reasons. Life has given me a lot. I owe great debt to this country that allowed me to flourish. We began as a mama-papa operations in 1984 in this city, and we have grown to become a nationwide company. All this happened in Anaheim, and it is our desire that all the things that are being given to us by this community, we find a ways to give it back. When we began this, there was no Obamacare. 36 million Americans were without insurance. And good health is a basic necessity for all human beings. To understand that these people need the quality care, but they cannot afford it, and hence they cannot have it, is not right for America. It's not right for us to allow it to go on. So we wanted to do our share in terms of offering free medical services to this city, to the communities where we flourished. So that's how we thought of this one. This is just sense of gratitude. We owe you one, city and United States. So we hope that this will do some good, and we hope to make this a permanent fixture for city of Anaheim, that Anaheim Healthcare will become a role model for other cities in the county, state, and maybe the nation. So we want to do the most we can in order to make it happen. So thank you, Anaheim. And we are delighted that God has given us opportunity to pay back to the way we can. Thank you.
Hi, we're here to support the Anaheim Health Fair, and we've been involved as a family for the 10 years that the Health Fair has been around. It was actually a concept that came to be in Anaheim by my father-in-law, Pravin Mody, and he, along with Dr. Nitin Shah and Harry Sidhu, brought the free health fair to Anaheim 10 years ago. And we are just absolutely thrilled to see how it's grown and evolved over the years. We started in small community center, and now we're in the convention center. So it's great to be a part of such a great event.
And can I get your thoughts on today's event?
Sure. My father was a firm believer that if you do something, you do it well, and you put your whole heart into it. And that included giving back. And so for him, being a part of this Anaheim Health Fair was incredibly important. And I know he's looking down on us above, smiling to see that at our 10th anniversary, it's doing amazing.
While others in the professional fields are seeking to find out how much money they can make, what made him such a humble man to want to give back so much?
Well, Mom, do you want to say a few words about that? Okay. It's obviously it's a very special moment being here, but I think one of the things we've learned from him is we're an immigrant family, and so like a lot of immigrants, we have the typical immigrant story of coming here with nothing and building a life for ourselves, and really being appreciative of this country that allows us to give back and take advantage of those freedoms. And so we feel it's our duty to give back to our communities and give back to this great country. I think that's one of the things that makes America special, is how much giving that we as a country do compared to other countries in this world.